So you've mentioned Australia, you mentioned research, and you mentioned education. So I think those three things would be really cool to explore with you a bit more today. So Amanda, you were wondering as well, does co-production happen in Australia?
Yeah. Is it something that people
very
are
much
doing
so?
today?
Yeah.
Oh, really?
Yeah,
Oh, wow.
very much so. So I think my background is largely research, and in research, say for the major grants here, it would be NIHR and also the Medical Research Council. In Australia, the equivalent would be the National Health Medical Research Council, but these days to go for any sort of grants and get funding, what you need to show is not just, it used to be some pilot data, but it's pilot data and how we have engaged the patient-public population, so PPI, patient-public involvement. So you really, if you don't have that and putting in a grant, you pretty much won't get the grant. So they're very serious about involving people and co-production in Australia.
And when did that change? Yeah. So I'm just wondering, is that a recent change?
I think, no, it's probably about, I would say, 6-7 years ago. So it sort of is quite recent.
Have you seen any of this engagement or involvement in action? Have you been at any of the sessions or?
Yes. So when I was in Australia, we always tried to, as much as possible, involve everyone that we could, not just the patients, but as I mentioned before, we focus very much on supporting carers and family because what we've found out, my background is a psychologist, and I've always worked in the past with cardiovascular patients. And we've done studies that showed with cardiovascular patients they experience a lot of anxiety, depression, which is expected after a cardiac event. But if we give those measures at the same time to carers and families, they can actually be higher than the patient. And that's because they're the ones that have to change their lifestyle to care for people and no one's supporting them.
Yeah.
So we always make sure with the interventions that we develop that they're involved right from the beginning and they're involved throughout and right through to the end stages, through to the evaluation. And that's why I think in the beginning stages, I remember in Australia it was called co-design, and it was called co-design because people were only engaging with a range of people at the initial stages, so helping to design the intervention. But they weren't kept on in terms of looking at prototypes and looking at the evaluation and being part of the evaluation.
Like
so then
the further process.
Yeah, so then over time it became co-production, so we're involving them throughout.
That's a great example. Thank you.
Yeah, it's a really good one.